Next, we're going to be moving on to the anticoagulants that are considered indirect thrombin inhibitors. Unlike the newer drugs like Pradaxa, they don't directly inhibit thrombin, but they work on factors that eventually act on thrombin. These are going to be the traditional medications that you're probably more familiar with, the heparins, the low molecular weight heparins, and these have a number of uses. They prevent the formation of new clots. They stop any clots that you already have from growing in size. They are used often post-surgery. Anytime anyone has had surgical intervention anywhere in the cardiac system or in the veins or arteries, there's a risk of the blood slowing down and clotting. And this way, they can prevent that by giving a temporary prescription for heparins, or maybe one of the low molecular weight heparins like Lovenox. Also, patients with heart valve disease, especially if they've had to have a heart valve replacement, you're going to have circulation that is not as smooth through those new heart valves, especially if they are the plastic and metal heart valves rather than the porcine heart valves that involve using the valves of a pig that are very compatible with the human heart. Certain dysrhythmias and patients receiving dialysis. Of course, when you've got blood that is moving through an artificial circulation system, like they do in dialysis to clean the blood, they will include heparin as part of the dialysate to keep that blood from clotting as it's moving through the machine and being cleaned out. They're also going to order anticoagulants for people who are on prolonged bed rest or who have a history of clots to begin with. When I worked in labor and delivery, we would many times give Lovenox to our moms who were on bed rest because of pregnancy-induced hypertension or premature labor, because they were spending so much time in bed that we didn't want to risk their blood pooling anywhere that could increase the possibility of clotting. Now, with anticoagulants, we know that heparin is not absorbed if it's taken orally, so it needs to be given sub-Q or IV. Why can we not give it IM? Think about that. The muscles are very rich in blood supply, and of course, giving an anticoagulant into the muscle is going to really risk a patient getting a hematoma or an area that is not going to stop bleeding. So it's very dangerous. So we want to make sure that we're giving sub-Q doses if it's a low molecular weight heparin and not getting it into the muscle. Heparin sodium can be given IV, and that's for emergent situations. It's always heparin sodium. It's not any of the low molecular weight heparins. The low molecular weight heparins are given subcutaneously. They bind to antithrombin. They're going to disrupt that clotting cascade so that it takes a longer time for a clot to form. Low molecular weight heparins like Lovenox are very stable. They have a longer half-life. They're safe to give at home. They don't require a lot of follow-up testing. Regular heparin sodium increases the action of antithrombin 3. Notice that that's in red. Antithrombin 3 is known as the heparin cofactor, and this heparin cofactor affects several other coagulation factors and slows the development of new clots. When somebody is on heparin, especially IV heparin, that's getting into the bloodstream very quickly, they're going to need a test called activated partial thromboplastin time, or APTT, activated PTT. And I will go over those tests that are required for the different anticoagulants in a future slide. The most common adverse reactions to any of the heparins, of course, is excessive bleeding. That's the biggest risk. It is also possible to have an allergic reaction. Sometimes people will tend to lose their hair or have thinning hair. Males can end up with persistent erections, and various types of allergic reactions. Read the list in your book on page 271. One thing about heparin sodium is that it is safe to breastfeed. On heparin, it's not passed through breast milk. So if you've got a new mom who's on heparin, it's considered safe to breastfeed if she's getting that sub-Q. Whereas many of the other anticoagulants, especially Coumadin, is really a category X drug when it comes to pregnancy, and the jury's kind of out about breastfeeding, but heparin is not passed in breast milk. Heparin should be held in the event of heavy menses. If a woman of childbearing age is taking heparin and she notices that her periods are becoming very heavy, that could be a sign that she is not doing well. The clotting factors are being overly affected, and she should call her healthcare provider. One very rare but extremely severe and dangerous adverse reaction with heparin is HIT, or heparin-induced thrombocytopenia. It very, very rarely happens, but if it does, it just interferes with the whole clotting cascade, and the person, rather than stopping the blood clotting, they will stop for a while and then overreact and start clotting too much, and it can lead to amputations or death. And I went to nursing school with a girl whose dad was being treated for various healthcare issues. He was treated with heparin, and he ended up going into HIT. He ended up having both legs amputated below the knee and finally passed away. So she was not a fan of heparin drugs when we talked about those, but it's very rare, like I said, rare but devastating. The heparins interfere with aspirin and NSAIDs. Once again, they can increase the risk of internal bleeding. Because heparin is very high protein, you want to make sure that you are rolling the heparin bottle between your hands. Don't shake it and break those molecules. Very similar to insulin. And when you give an anticoagulant sub-Q, don't aspirate. Of course, you don't aspirate generally with a sub-Q injection anyway, but make sure you're not massaging that sub-Q site. It's going to bruise on its own even without doing any massaging, so you don't want to add any extra bruising by being too hard on that IV site. I'm going to stop here before we get into the oral anticoagulants like Coumadin and Jantavin, and go ahead and upload this video and we'll get back to it.